Hello, my name is Dr. Vanessa Casanova. I'm Associate Professor of Occupational and Environmental Health Sciences here at the University of Texas Health Science Center at Tyler. I'm also the Director of the Southwest Center for Agricultural Health, Injury Prevention, and Education. The Southwest Ag Center, as we call it, has been here at the university for going on 25 years. The focus of our work is on research, education, and outreach to workers in agriculture. This includes farmers and ranchers, owners of row crop production, hired farm workers, workers in forestry and logging, workers in commercial fishing. Most of the work we do is really focused on good health and safety outcomes in this work group. Today I'm going to talk to you about a really important topic, both in agriculture and just in general. I'm going to talk to you about heat illness, how to prevent it, and how to keep yourself safe this summer. As you know, July is usually one of the hottest months of the year, especially in this part of the state. We're beginning to see temperatures rise into the upper 90s, high rates of humidity. And if you're not acclimated to this kind of temperature and humidity level, you might suffer heat illness. So I'm going to talk to you today about how to prevent heat illness. It's important to understand what heat illness looks like, as well as precautions one should take. OSHA, the Occupational Safety and Health Administration, launched a campaign in 2011 to help bring awareness to this hot topic. If you live in Texas or experience extremely hot summers, you may have experienced heat illness or heat stroke. 3 simple words might help you remember what to do to prevent heat illness. These 3 simple words are water, rest, and shade. According to OSHA, thousands of employees become sick each year, and many die from working in the heat. In 2012, there were 31 heat-related worker deaths and 4,120 heat-related worker illnesses. Labor-intensive activities in hot weather can raise body temperature beyond the level that normally can be cooled by sweating. Heat illness initially may manifest as heat rash or heat cramps, but can quickly escalate to heat exhaustion and then heat stroke if simple preventive measures are not followed. Heat illness disproportionately affects those who have not built up a tolerance to heat. Again, this is called acclimatization, and it is especially dangerous for new and temporary workers. Remembering water, rest, shade could help save the lives of your workers and yourself. Make sure to check on your workers. Heat illness can happen quickly. Know the symptoms. Have you ever experienced any symptoms of heat illness? Some of these include feeling hot, excessive sweating, nausea, fatigue, weakness, fainting, headache, irregular pulse, dizziness, or confusion. Many of the symptoms related to heat illness can be exacerbated by some pre-existing conditions, such as obesity, fever, dehydration, use of prescription drugs, heart disease, poor circulation, sunburn, and alcohol use. Now, I am talking about heat-related illness in the context of work, and in particular agricultural work. However, knowing the symptoms for heat illness is important for individuals as well as workers. During this time of the COVID-19 pandemic, many of us are working from home, and many of us are taking extra precautions, such as not going to the gym, not gathering in group exercise activities, and instead enjoying walks outdoors, hikes in state parks, and other forms of outdoor exercise. It's important, especially in the summertime, to keep yourself safe from heat illness. Symptoms of heat illness include feeling hot, excessive sweating, nausea, fatigue, weakness, fainting, headache, irregular pulse, dizziness or confusion while working or exercising in hot summer temperatures. So the take-home message for this walk with a doc is to know the symptoms of heat-related illness and to always remember that confusion or disorientation is a very serious symptom of heat-related illness that requires medical attention immediately. Thank you very much.